Hi guys, so I want to show you this interesting debate between Keir Starmer and Boris Johnson in Parliament today.
Yesterday, the Chief Executive of Care England, in his evidence, was also asked when routine testing would start in care homes. This is the answer he gave yesterday. I think the short answer is that we've had the announcement, but what we haven't had is delivery.
And this makes perfect sense when you think about how dysfunctional Boris Johnson's administration and government is. They make announcements, but they never follow through with action. This is still the Brexit mindset. Tell people something, but don't actually follow through with it. Don't actually put in place a mechanism to complete the task. Now, this is okay if you're talking to some knuckle draggers or whatever, but this is much more serious, and it's not acceptable when you're telling the health service that you're going to provide resources to do testing, or you're going to provide them with PPE, because they don't care about announcements. They care about facts. They care about action.
And we are not really clear when that will arrive. This is the Chief Executive of Care England in his evidence. Even the government's command paper, published last week and introduced by the Prime Minister to this House, says within it, the command paper, I'm quoting now, the Health Secretary says he's wrong, quoting the government's paper, every care home for the over 65s will have been offered testing for residents and staff by the 6th of June. That's from the Prime Minister's command paper. That's over 2 weeks away. What's causing the continued delay in routine testing in our care homes?
Already, 125,000 care home staff have been tested. 118,000, perhaps he didn't know that, Mr. Speaker, 118,000...
But that's not what he asked. He asked, when is routine testing going to take place? Testing for residents, people who are in the care home. When are they going to be tested? And of course, Boris Johnson doesn't listen to the question, or he ignores the question, and he answers a different question.
Care home workers have been tested, and we are absolutely confident that we will be able to increase our testing, not just in care homes, but across the whole of the community.
So we are confident we will be able. So why is Boris Johnson always talking about what we're going to do in the future? He was asked a question about when are you going to actually test these people in the care homes, the routine testing? And he gives examples of staff being tested, and then he makes another announcement about when they're going to test people in the general community. Yeah, we're going to do it. There's no dates. There's no numbers. There's nothing that you can actually latch onto and understand whether it has been achieved or not.
Again, the question was when routine testing would start, and the Chief Executive of Care England, who knows what he's talking about, gave evidence yesterday that it hasn't. If the Prime Minister is disputing the evidence of the Select Committee, that's his own business.
Order. Secretary of State for Health, please. I don't mind you advising the Prime Minister, but you don't need to advise the opposition during this. Do you want to lead the chamber on maximum numbers? If you want to give way to somebody else, I'm more than happy.
So Matt Hancock was brought along to cheer for Boris Johnson, to back up Boris Johnson. Boris Johnson has his arse handed to him every time over the last number of PMQs. And he needed some, moral support. He needed someone to back him up. I've talked about this before. How Boris Johnson is in his element when he has 100,000 yahoos behind him screaming him on. But now that he's on his own, or now he actually had to bring Matt Hancock along, he can't respond to these questions. He's an empty suit.
Keir Starmer.
Mr. Speaker, and to assure the Prime Minister, I'm not expressing my own view. I'm putting to him the evidence of experts to committees yesterday. Testing, as referred to by the Prime Minister, that on its own is obviously not enough. What's needing is testing, tracing and isolation. Despite 2 million tests having been carried out, there's been no effective tracing in place since March the 12th, when tracing was abandoned.
Now, this is something very important. So tracing in the UK took place, but it was abandoned. Now, why was it abandoned? We know very clearly that tracing is important. I've talked about this before, how it's important that you test the general population, you find people who are infected, you trace the contact that they have had with other members of the public, and then you isolate and then test the contacts and isolate infected cases there as well. This is very important. You continually test, trace until you get to a point where you're no longer finding infected individuals. But this requires time, this requires resources, this requires staff. But the government don't seem to be interested in doing that. Now, something interesting, I've talked about South Korea, but another country that's interesting to compare to is Germany. So Germany started contact tracing on the 25th of March. They had 5 tracers per 20,000 people on average. And by the start of March, the beginning of May, so they started on the 25th of March. By the beginning of May, 11 of the 16 states, the federal states in Germany, had achieved their target. So that was a very good result. Now, why did the UK start testing and stop testing? Boris Johnson is talking about hiring more testers. Well, we'll hear about that in a moment.
That's nearly 10 weeks in a critical period without effective tracing. That's a huge hole in our defences.
I've given the right honourable gentleman repeated briefings on this matter and many others. He's perfectly aware of the situation in the UK as regards testing and tracing.
He's perfectly aware of the situation. Well, what is the situation, Boris? Why don't you share it with the public, what the situation is? The situation is probably, we made a mistake, but we don't want to admit to it.
In early March, it's been explained many times to him and to us. But what I can tell him, and I think his sort of feigned ignorance really doesn't come.
And now you're resorting to insults. So you can see that Boris's his feathers have been fluffed. No, how do you say fluttered? He understands he's in a corner now. He's painted himself into a corner. He understands that he's made a mistake. It was a mistake to end testing. A number of weeks have passed while the cases continually ramp up and there's no tracing taking place. And now what you're doing is you're reintroducing testing and tracing. But why?
Very well. But what I can tell him is that today I am confident that we will have a test and trace operation that will enable us, if all the other conditions are satisfied, and it is entirely provisional, that
Why? Why do you need to have other conditions ready? Why isn't testing and tracing done from the very beginning? The very first cases, test and trace, like in South Korea did. This doesn't make any sense. You're halfway through a peak, and now you're talking about tracing people. Once again, it's like the quarantine. The quarantine implemented at the end or halfway through the pandemic. The quarantine should have been implemented at the very beginning. You're doing the same thing again. You're tracing halfway through the pandemic. It should have been implemented from the beginning. Someone probably had their ear to the ground and realized tracing was important, and you started to do tracing, but then you stopped it for some reason.
Will enable us to make progress, and I can tell him also that by the 1st of June, already we've recruited 24,000 trackers, and by the 1st of June we will have 25,000. They will be capable.
Now, it's very important to understand what these trackers do. Now, some of the information I have is a little bit out of date. He's talking about 25,000. Now, the data I've been looking at is 18,000. But this is probably still quite useful to understand the problem with Boris Johnson's ideas surrounding trackers. So the data I have for the 18,000 is 15,000 will be call handlers, while only 3,000 will actually be health workers. So I don't know how many of these 25,000 that he has recruited, how many of these are going to be people answering the phone, and how many of them will be people on the ground doing the legwork. I think it's important. You have to be transparent with the public. You have to be transparent with your figures. But unfortunately, Boris Johnson will not be transparent.
Of tracking the contacts of 10,000 new cases a day. And to understand the importance of that statistic, I should just remind him that today the new cases stand at 2,400. So we're making vast progress in...
How is that progress? Your cases are over 2,000 cases today. I don't see how that's progress.
Testing and tracing, and I have great confidence that by June the 1st...
But if how can you be making progress if you haven't started yet? You said by the 1st, we're going to have all of these people up and running. Then how are you making progress? You make progress after they're up and running. But once again, what is the point in doing all of this at this stage? It's late. Maybe it's too late to start tracing.
First, we will have a system that will enable us, will help us very greatly to defeat this disease and move the country forward. And I hope, therefore, that he will abandon his slightly negative tone and...
Abandon his negative tone? How is he being negative here? He's pointing out the facts. Unfortunately, the facts go against your narrative, the narrative that you're on top of this, the narrative that you're doing everything within your ability to deal with this crisis, the narrative that you didn't have a shortage of PPEs when you actually did, the narrative that you were doing sufficient testing when you weren't, the narrative that you didn't abandon tracing when you did.
Support it.
Keir Starmer.
34,000 deaths isn't negative. It's negative. Of course I'm going to ask about that. I'm quite right too.
And he's right. 34,000 deaths is some... Should he be happy about that? Are we going down the Donald Trump route of this Medal of Honor? What is it? 1.3 million cases is a Medal of Honor. Is Boris Johnson going to emulate Donald Trump in that way? Let me know in the comments, guys. As always, your comments are much appreciated. I'll leave a link to the original video in the description if you'd like to watch it without my comments. Thanks. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun. If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.